Thank you, Madam Chair. I'd like to speak in support of my bill, H.R. 5555, as amended, the Durable Medical Equipment Point of Service Relief Act, and I'm grateful for the committee's consideration of this critical bipartisan legislation. Over 66 million Medicare beneficiaries receive services under the DMEPOS benefit. The benefit allows patients to receive medically needed treatments such as oxygen, wheelchairs, and medical supplies in the comforts of their home, keeping them out of expensive inpatient settings such as hospitals and nursing facilities. Due to the implementation of the DMEPOS competitive bidding program, which applied pricing derived from highly populated competitive bidding areas to all areas of the country, there has been a significant decrease in payment rates, which caused a significant number of DMEPOS location closures. Just this last year, about 11% of the DMEPOS locations closed, further diminishing beneficiary access to DMEPOS suppliers. The loss ultimately leads to far less patient access and choice. The bid program was put on hold in 2018 due to a need to update the bidding process, and it was put on hold again in 2020 due to no additional savings. In all, the bid program has been on hold for the last 5 years, resulting in DMEPOS payments continuing to be based on rates from the flawed bidding program. My legislation, H.R. 5555 as amended, which I am proud to be leading, would provide much-needed rate relief in former bid areas and non-rural areas, which will help protect patient access to cost-effective home-based care. According to the Kaiser Family Foundation, among Medicare beneficiaries in traditional Medicare, most, 86%, had some type of additional coverage in 2020, either through Medigap, 36%, employer coverage, 31%, Medicaid, 17%, or other source, 1%. Without relief to DMEPOS competitive bidding and non-competitive bidding areas, Medicare beneficiaries may lose access to the medical equipment they need, forcing them to go to an emergency room or a long-term care facility. This would increase cost of the Medicare program as well as the beneficiary. I'm aware that some of my colleagues on the other side of the aisle are opposing this legislation over grievances of an unrelated policy relating to the state health insurance assistance program. Like my Democrat colleagues, I too want to assure that Americans are aware of their public health care options. However, unlike this DME policy, the SHIP program still receives discretionary funding. Patients will lose access to life-saving equipment without relief for DME providers, and it is good policy. I urge my colleagues to support the AINS and the underlying bill, H.R. 5555, and I yield back the balance of my time. Thank you.